I'm going to talk a little bit about addressing whether or not you have the capacity to learn something new. And this is for all of my older adults that are looking to go into nursing school or even to return back to school. This might be a concern. We often say, like, am I too old to learn something new? Am I going to be able to grasp the concepts? And the answer to that in a nutshell is yes. Yes, you can. We are older, yes. And usually that is associated with slower cognition, slower ability to learn things. You might be forgetting that you have more experience. You are able to identify things and what's going to be happening and the progression of things and the sequence and patterns of things because of that life experience. But here are some things that you can do to help you in nursing school, because it is very study intensive, obviously, because you're learning to what things to recognize, what treatments to give to save somebody's life, right? And to help them get better from whatever sickness that they're recovering from. So one thing that you can do right now is stay mentally active. Play games, do puzzles, anything that stimulates your mind and helps you to learn something new, just to stimulate those neural pathways or create new neural pathways. Take on another hobby, practice with something that you would have to learn a new skill. Learn the piano, learn how to play the piano, learn how to paint, learn how to draw, do things like that. Something that will, like I said, create new neural pathways to help yourself become more confident with the fact that you are able to learn. You're not competing with anyone. It's not that these younger students know anything better than you. It's not that they can perform better than you or that they're sharper than you. I think we have to get rid of that notion that when you're past a certain age, you're slower. You might be physically slower in doing things, and know to take your time. Yes, gradually as we age and we have more breakdown in our nerves, we may become slower in our 80s and things of that nature. But that's not true for a 30, 40, 50, 60-year-old that's going into nursing school. Another thing you can do to help with that impression that you might learn things slower is to utilize study strategies. So the main thing that I recommend with this is to learn how you best learn. I'm a tactile learner. Some of you may be auditory learners, so you can sit there and you can listen to a speech and you got it like that. For me, it's not clicking when I just listen. You know, I need you to show me the thing and I need to be able to do the thing. So that's the way that I best learn. Some people utilize concept maps. So what that is you put the big main idea. For some of us, we are familiar with this concept of brainstorming when we were little. You put the main idea in the middle in a bubble, and then there will be certain stems and another a lesser main idea, but it all supports that middle thing. So in a concept map, you can make concept maps and make them as colorful as you want to. Lots of people do that with their notes. You may also look it up on Pinterest to get an example of what that is. So you might put a disease process in the bubble, like diabetes. And one stem you might put it in ADPI, meaning assessment, diagnosis, planning, interventions, and evaluation. So you're going to put that main idea, diabetes, in that middle bubble and stem off with ADPI, so assessment. What are you going to do for your assessment for the patient with diabetes? What are you going to do for the diagnoses? How are you going to come to that diagnosis? What things need to be done? What tests need to be run in order for diabetes to be confirmed? Planning. So what kind of treatments are you going to do? Or would you expect from the doctor, orders and such? Interventions. What are you going to do for it? You know, that can be another line. And evaluation. How are you going to evaluate that your interventions were effective? So that's a concept map, and helps you to kind of solidify what to do for that chronic disease process in your mind. A visual learner, that also falls into being a visual learner. And I'm also that. I'm a little bit of everything. I need a little bit of everything. So I would record the lectures, I would jot down notes, I would also, do my concept maps, highlight everything, not everything, but the important things, because there's a lot of filler in some of these studying notes, or in some of these notes, or the books that we read from. So you kind of have to whittle it down, look at your PowerPoints, things of that nature. Find out what kind of learner that you are. And the second thing is, or the third thing, join study groups. In nursing school, there are lots of people looking for study groups. So go ahead and join one. If you are an independent learner like myself, you know, I would say that I had a disservice. I would learn the material, study myself, and then I would jump on a study group sometimes, you know, if time allowed. But as an older adult, most of the time I don't have time. I have kids to take care of, I have family things that go on. So I don't have time to jump in a study group at 2 o'clock, you know. So I would do the best that I could to join study groups. But if you have that availability to be able to join a study group and you find them effective for you, by all means do that. So hopefully these tips have helped you, especially in the area of whether or not you think that you're too slow to go to nursing school. And what I mean by slow is that you think you're a slow learner, or you may not grasp the concepts. The concepts are hard to grasp for anyone, but you have to be able to know yourself and know how it is that you best learn. That's your first step. And also engaging your mind in activities so that you can create those new neural pathways, and to give you that confidence that you can learn something new. And join study groups, connect with people in nursing school. And you might even be doing that now as you fulfill your prerequisites for nursing school. You might even be joining study groups now. Just find out what it is and the best way that you learn, and you'll be golden. You can do this. The bottom line is you can do it. If I could do it, you could do it, okay? And many other nurses have done it as well who are older. So we are a generation of nurses that come with more experience, and we have other things going on in our life, but our mind is already set up for it. Those neural pathways are there. You can definitely do it, okay? Hopefully you found this video helpful. If you have any other videos that you'd like for me to make, that you have questions on, please do drop it down below, and I'll get to them as soon as I can, okay? Hope you have a great day. Bye.